If you breathe through your mouth, you are exchanging oxygen in the upper third part of your lungs, which is very inefficient. You're not getting enough exchange of oxygen into the blood. This leads to less oxygen in the body, which makes the heart rate increase to try and get more oxygen to the organs and tissues. This will lead to early cardiac arrest. Also, breathing through your mouth, you have no filtration of air, and this will lead to allergies and irritation, which may cause tonsillitis and increase in adenoid size. With sleep apnea, as a result of a large tongue blocking your airway, you will start to breathe through your nose. Sleep apnea will also result in tongue thrust and grinding. The grinding is as a result of the tongue being pushed forward while sleeping, and this indirectly causes grinding of your teeth. This is as a result of increased CO2 in the blood, and the brain triggers and tells you to start breathing by pushing the tongue forward, which also results in the tongue thrust and grinding. If you breathe through your nose, you have filtration and you have diaphragmatic breathing, and the air exchange is in the alveoli and is much more efficient.